How are tattoos removed?
Tattoos are very popular, yet a lot of people often want to get their tattoos removed, often referred to as tattoo regret. Patients have told me that they made an impulsive decision when they were young and are now embarrassed by their tattoo. People also come in requesting to have an ex-significant other's name removed. Many times, visible or certain types of tattoos are not desirable in certain work environments. Fortunately, laser technology can be highly effective in helping people deal with their tattoo regret. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. In addition to cosmetic surgery, hair restoration, and skin rejuvenation, I employ several lasers and radiofrequency devices in my practice for treatments like skin tightening, improvement of hyperpigmentation, skin resurfacing, as well as tattoo removal. As mentioned earlier, patients with tattoos often regret having a particular tattoo. I'll discuss how I assess tattoos in my practice and how I formulate a plan for my patients. Tattoos are made up of different shades of ink or pigment and are placed at the deeper level of the skin called the dermis. In my practice, tattoo removal involves turning these large deposits of ink in the skin into finer particles using a laser. These fine particles can be carried away from the skin by the body after laser treatment. During consultation, I evaluate the tattoo and apply what's referred to as the Kirby-Desai scale. This scale uses factors such as skin type, location on the body, amount of ink, layering, scarring, and tissue changes, as well as the colors of the ink to estimate the number of treatments needed. Ink color is important as different wavelengths of light are needed to treat different colors. Some colors are easier to treat than others. For example, a dark monochromatic tattoo with black ink is relatively easier to remove because black ink only needs one particular wavelength applied to the entire tattoo. A tattoo with multiple colors, such as blue, yellow, and red, will need specific wavelengths of light to be effectively treated. In our practice, we do something a little different from traditional tattoo laser protocols. Typically, tattoos are treated with Q-switch or picosecond or picosecond lasers. When the tattoo is treated, the pigment creates a gas which can create a sensation like hot oil splattering on the skin. This can be quite painful. In addition, it's common to have a lot of blisters afterwards. In my practice, I routinely use local anesthetic injection for pain so the treatment is well tolerated. To minimize blisters and expedite the removal of ink, we use a combination of lasers. The tattooed skin is first treated with a fractional erbium laser. The fractional erbium laser creates microholes to allow for gases to escape during the laser procedure, preventing or minimizing blister formation. The use of the fractional erbium laser also allows some of the tattoo ink that's broken down by the treatment to be removed externally through the surface of the skin as opposed to having the ink particles removed only through the lymphatic system internally. After the fractional erbium laser is completed, I then use the appropriate wavelengths for the pigment to be treated using a Q-switch laser. We use 1064 nanometers for dark pigment, such as the color black, 532 nanometers for red, purple, and orange tattoo inks, 650 nanometers for green ink, and 585 for blue ink. The combination of the erbium laser with Q-switch laser and the use of local anesthesia makes the tattoo removal process more comfortable and with faster healing. Tattoo removal typically takes several sessions for the treatment results to be acceptable. As treatment progresses, the original tattoo will be visible but fading with each subsequent session. Using this combination of the Q-switch and fractional erbium, there is a potential reduction by 30% of the number of sessions needed to effectively treat a tattoo. The intervals between treatment sessions are usually 6 to 8 weeks apart. Some basic skincare involving topical ointment and a dressing is routine for a few days after treatment. Many people who come to me with tattoos who were initially reluctant to have treatment because of the pain and healing process they observed when watching procedure videos online. By applying a combination of advanced laser technology and local anesthetic, I can state that tattoo removal can be done safely with minimal discomfort and faster healing than has been experienced with traditional procedures. I hope you found this information helpful. Thank you for your question.